The most common types of exertional heat illnesses are heat syncope, heat exhaustion, and heat stroke. These most commonly occur during the summer months when the temperature and humidity are high. However, they can occur in most weather conditions. Heat syncope can be recognized by a sudden collapse during or immediately after physical exertion. These patients will improve within a couple minutes when lying down with their feet elevated. Heat exhaustion patients will present with staggering collapse, dizziness, confusion, headache, syncope, or excessive fatigue. Heat stroke patients will present with similar symptoms, but their rectal temperature will be above 105 degrees Fahrenheit. Heat stroke patients may also present with more CNS dysfunction, causing them to become combative and resisting treatment. All these patients should be moved to a cool, shaded area if possible and remove all excess equipment. This is where the rectal temperature should be taken to determine official diagnosis. The patient should be placed in a sideline position with their top, hip, and knee flexed. They should then be draped with towels or sheets to allow some privacy. The athletic trainer must put on gloves before cleaning the thermistor. The thermometer should be turned on and plugged into the thermistor. The thermistor should then be lubricated and inserted 4 inches past the anal sphincter. The thermistor would then be taped to the skin of the patient to prevent accidental removal. This will allow continuous monitoring of the temperature of the patient throughout treatment. If the temperature is above 105 degrees Fahrenheit, combined with the previously mentioned symptoms, the patient can be diagnosed with heat stroke. Cold water immersion would be the ideal treatment for this patient. This would mean immersing the patient in a tub filled with water between 35 and 55 degrees Fahrenheit up to the patient's neck. When cold water immersion is not available, the next best method is the taco method. This requires the patient to be lying on a large tarp. Rescuers will hold up the sides of the tarp as ice and water are added. The patient should have a towel wrapped under their shoulders and someone should be designated to hold them up to prevent drowning. Water should be added up to the patient's neck if available. The rescuers holding up the tarp should shake the tarp. This allows the water to continue moving and maintain a convection process, pulling heat from the body. The patient should be cooled until their temperature is below 102 degrees Fahrenheit and then transported to the nearest hospital equipped to treat exertional heat stroke. If the initial temperature reads below 105 degrees Fahrenheit, then cold water immersion is not needed, although it is still recommended as a conservative treatment. Cooling of the body should still be performed with ice towels. If the patient does not improve significantly in 5 minutes, reassess temperature and consider a change of treatment.